Now another very interesting image for all of you. What do we see? I can see the dye going into what? Dye going into urinary bladder and urethra. If you're seeing the dye in the bladder and urethra, the name of the investigation is gonna be MCU. MCU, micturating cystourethropy. Examiner can ask you the parts of the urethra. So what are the common parts of the urethra? This is which is close to the bladder is prostatic urethra. After the prostatic urethra, this part becomes membranous urethra. Both are the part of posterior urethra. Then this bulbous part is bulbar urethra and this part is penile urethra. So bulbar and penile urethra are the part of anterior urethra. Anterior urethra. If somebody asks you, do you see urethral injuries? Answer is yes. Very commonly asked in the exam. Which is the common part of the urethra to be injured? Anterior urethra. Anterior urethra. And which part of the anterior urethra? Bulbar urethra. Bulbar urethra, because straddle injuries are the more common injuries. But if the urethral injury is happening secondary to an RTA, RTA leads to pelvic fracture. And if there is a pelvic fracture, which is a preferred part or the common part of the urethra to be injured, membranous urethra. So look at the question, what is given in the question, and according to that will be, you're gonna select the best possible answer for that. These are very standard question of the paper. These are the low hanging fruit. You cannot afford to miss any number in this particular part.